We're going to start, we've got some COVID issues, but we're going to start briefly with Supervisor Mary Adams and Office of Emergency Services, Kelsey Scanlon, who are going to talk about an upcoming webinar for those who live in and around our burn scars, because recovery is still a major issue. And with debris flow recently, they have a lot of needs still. Good afternoon, ladies.
Good afternoon.
Mary, I wonder, Supervisor, I wonder if you would start off and talk about the importance of this webinar for those residents.
Thank you so much, Maya, for inviting me and my stalwart buddy over here, Kelsey, without whom I could do nothing when it comes to this sort of work. But, you know, we're all so caught up, quite frankly, at this point with concern about COVID and concern about vaccines, that many people are forgetting that there is a whole group of people who suffered terribly during the Dolan, the Carmel, and the river fires. Not only did they suffer the loss of their homes in many cases, but now after the atmospheric river that came through just a couple of weeks ago, they've suffered from terrible debris issues. They've had lots of mud washes and mudslides. We've seen so much damage after the damage that was already sustained through the fires, that fortunately my office and the Office of Emergency Services is going to be hosting a webinar tomorrow, Thursday, February 11th at 5:30, from 5:30 to 7:30, to get an update on where we stand with debris removal particularly. I think it's really important for those people, particularly in the burn scar areas, but I think for the rest of us too, you know, just to understand that there are other things that are going on, and some people have it a whole lot worse than others do. So actually, Maya, if you don't have another question for me, I'm going to turn it over to Kelsey Scanlon, who is going to be the, let's see, what could I say? The number one, the top of the charts as far as what we're going to be talking about tomorrow evening. Kelsey has gone through so much on her own. Actually, when she came to us from Sonoma County, where she had worked up there and had sustained a lot of the wildfires that they had. I think it's been 3 years ago now, Kelsey, something like that, 2 or 3 years ago.
Just about, yeah.
Yep, and so we're really fortunate to have her with us. And I must tell you that on a personal note, I hope you don't mind my saying this, that Kelsey sustained some very bad damage to her home during this most recent atmospheric river. And my heart goes out to you. So with that, I think I'm just going to take the ball and pitch it over to Kelsey, who looks like she's just about to catch that ball.
Oh, got it.
Good, thank you.
No, thank you so much for your kind words, Supervisor Adams. I think you really explained what it is that we're trying to do tomorrow, but I wanted to reiterate the agenda. So this is the 6th recovery meeting that we'll have. And I also want to point out that the recovery meetings leading up to the atmospheric river really prepared not just our office, but the community for the impacts that we eventually did see, specifically on the river fire burn scar, as well as the Dolan fire burn scar. And so we'll be talking not just about wildfire recovery, debris removal and rebuilding, but we'll also be talking about services available to people who are impacted by the post-fire mud and debris floods. So like I said, we encourage everybody to participate. It's a great learning experience, even if you hadn't, you know, sustained any losses, but it's really an opportunity to express your concerns, you know, share positive or negative stories from your experience during either the atmospheric rivers or from the wildfires, and to just give us, you know, feedback on, you know, how we served you or ways we could serve you in a different manner.
All right, thank you very much, Kelsey, for giving us that overview, and thank you, Supervisor Adams, for setting the tone for the meeting. Those meetings are very important, and I think anyone who has ever had an experience of loss really appreciates the care that has gone into keeping these webinars and information coming to those residents. Thank you, ladies, very much. We're going to move on to our COVID issues today. We're joined by Katie Castagna from the United Way. One of our most asked questions right now about registration for a vaccine is, I need some help making my registration. And the United Way and the county are working on a plan for that. And I was hoping Katie could just give us a brief overview of what is happening with that. Good afternoon.
Good afternoon. Thank you, Maya. We have been using the United Way 211 information and referral system throughout COVID to help people navigate and get information for everything from shelter in place to testing. Now, of course, the newest area of interest is vaccine registration. And the way that it's being handled statewide is through a web-based system. And we know that there are many people who have barriers to being able to access that themselves, whether it's digital literacy, language proficiency, or internet connectivity. So thinking about how to expand our safety net for people to make sure they're connected and able to access those appointments when they are eligible, we're going to be able to offer that as a service of 211 so that people can call 211 and talk to a specialist during the day, 7 days a week, and actually get registered and schedule an appointment for their vaccine. And it looks like there's a change in the platform that the county's using, and soon we'll be on the statewide platform, which one of the benefits of that is that you can actually register for your first and second dose. But what I want to stress is that this is really for the people that can't do it themselves. And we only have access to the same appointments that the public does through the mcvaccinate.org website. So our trained specialists will be there to help people who don't have the ability to do this themselves. And we're really excited to be launching that next week. So don't call now, but as of next week, this will be one more tool in our toolbox of helping everybody that is eligible access those appointments as they're available. And the caution we have is just knowing that there's a limited supply of vaccine and appointments. So we're working out sort of the protocols for how we can make sure that as those become available, we're there to help people sign up. So that's the process. We have new people at our call center that are being trained to have a specialized service. And so a caller to 211 would select a number in the phone queue, if you will, to get directly to that appointment scheduling help desk. And that'll be available 8 a.m. to 8 p.m. And we will do our very best to make sure that as appointments are available, we're there to help people get them. But again, the caveat is that anybody that already has access to internet can do it even more quickly themselves. And we're just there for the people that need that extra help.
Thank you so much for kind of giving us a preview of what's to come. I know people are looking forward to it. We're talking about next week. Have we pinned down a date, or I think the plan may be just to announce it when it's ready to go?
We'll announce it when it's ready, but hopefully by the beginning of next week. That is the plan.
All right, thank you. And then if you're able to stay on the line for any additional questions after our next presenter, that would be great. Thanks, Katie.
Thank you.
And now we're joined by Dr. Moreno. Always a pleasure to have him here. There was a lot of news yesterday about a change in those eligible to be vaccinated. And Dr. Moreno is going to join us to walk us through some of those changes. And then if there is additional data, the meeting yesterday was very full. And so hopefully there is some additional data he might be able to share with us that may not have been presented at the Board of Supervisors meeting yesterday. Dr. Moreno, I see you on the call? But you are.
Yeah,
there you are.
Yeah.
Good afternoon.
Hi. Okay, there we go. All right, hi, Maya. Okay, let's see. Hello, everyone. Ed Moreno, I'm the Health Officer from Monterey County and Director of Public Health. And I'm going to go ahead and share my screen so I could go through some of the slides that were shared with the Board of Supervisors yesterday, but also provide a few updates in addition to talking about the advancing through the California COVID vaccination plan. Let's see. Okay, are you seeing the presentation here?
Yes, it's up.
All right, good, thanks. Okay. All right, so this may look familiar, but this is the new approach that the state is taking in expanding availability of COVID-19 to more Californians. So we are still in phase one. I'm sorry, we're still vaccinating people in phase 1A, but many people there, healthcare workers primarily, have been vaccinated, and many of the skilled nursing facilities have had vaccine clinics already or have clinics set up, and the pharmacies are also scheduling with extending beyond the skilled nursing facilities. So that's good news. In terms of 1B, we're currently also in 1B with a portion of this group, the 65 and older, and that portion being 75 and older. And so we've had, there's been a tremendous amount of eagerness by many to make the vaccine available to additional people in what the state most recently called phase 1B tier 1. And so we're looking at, I'll go through this momentarily, but looking at some of the key considerations in deciding how to move forward in 1B. And then as a reminder, the state is no longer intending to move forward with a sector-based rollout of expanding eligibility to Californians. They're going with an age-based approach. And also we suspect that there will be a underlying medical condition component to the next steps for California. So as a reminder, one key consideration is this is California's COVID-19 vaccine plan, and we are implementing it at the local level. And we, as I mentioned, providers have made pretty good progress moving through phase 1A, the primary care providers, I'm saying healthcare providers. Very important key consideration is that in moving and advancing further through phase 1B, there's not enough vaccine to quickly vaccinate everyone in 1B. So we have to think about how do we make best use of the limited vaccine that we have until our weekly allocations increase. Another key consideration is that the state has issued some guidance for 1B, and that is to prioritize at the local level individuals who are 65 and older because they are at greatest risk of serious illness and death. And the evidence there is provided by the CDC, showing that at the age of 65 to 74 and 75 to 84 and 85 plus, those age groups are 90, 220, and 630 times more likely to die from COVID-19. So giving vaccine to this population will save more lives. So particularly if we have limited vaccine. Here locally, this is local information. We know that this is a chart that shows age groups here on the left, Maya, and then the proportion on the last column, this is the proportion of that age group in Monterey County, and then the proportion of fatalities and the proportion of hospitalized cases. So just looking at starting with the youngest age group, 0 to 17, they make up 25% of the population here in Monterey County and account for 2% of the hospitalizations. So that's how we read this. But we get into this group that the state has prioritized, 65 and older. They make up 14% of Monterey County population, but they account for 34% of the hospitalizations and 68% of the deaths. So again, the local data is consistent with the state data and the federal data, showing that this population is overrepresented and higher risk of dying from COVID-19. Another key consideration is that the state does intend for us and other counties to offer vaccine at some point to the other three sectors, those sectors being food and ag, childcare and education, and emergency services, with the caveat that as vaccine is available. We were able to change our initial projections of how long it would take to move through each of these groups in 1B. Previously, with the amount of vaccine that we were getting, we were looking at up to 23 months to vaccinate this entire group. But now we're receiving on average over the last couple of weeks about 3,200 first doses a week. That's an estimate. We do receive first doses, second doses week by week, but overall it's averaging about 3,200 first doses a week. And so with that slight increase, we can, it looks like it would take fewer months, approximately 16 months to get this through this group. The good news is that USDA has received another application for a emergency use authorization for a vaccine, and if that gets approved, and the state of FDA and the state of California agree on how that vaccine should be used and who should receive it, that should result in an increasing the number of first doses that we get, or doses, I'll just say doses at that point, the number of doses that we get per week for vaccinating this group, which would shorten the amount of time it would take for us to get through this group and hopefully move on to the next step. And another consideration, May, is that the state has encouraged counties, well, the state has continues to consider equity in its vaccine plans and its guidance, in addition to its allocation formulas that determine how much vaccine each county gets. And so they are encouraging us to do likewise here at the local level. So we are looking for ways to, looking for inequity and trying to incorporate strategies that work more towards equity and getting people equitably equitable access to vaccine. So this is looking at hospitalizations and fatalities by race ethnicity. We looked at it by age, and now we're looking at by race ethnicity. And we look to see that, for example, we'll start with Hispanic Latino population makes up 61% of Monterey County's population, and they account for 63% of the deaths and 77% of the hospitalizations. So slightly more represented among the fatalities, and definitely overrepresented among hospitalizations. And we also see there's other groups. Asian Pacific Islanders make up approximately 6% of the population, but 9% of the fatalities. So there are some inequity here, and we hope to implement strategies that try to address these inequities. Continue to look at race and ethnicity. This is looking at, that was looking at hospitalizations and deaths. This is looking at the vaccine information that we have. We are able to separate vaccinations, those that are vaccinated by age, and 75 and plus, 75 and less, excuse me, would be primarily healthcare providers in Monterey County. So the demographic that we see here would be impacted by mostly the demographics of healthcare workers. There are other issues that will influence this demographic, but in a large part, it's the demographics of healthcare workers that make up, that are responsible for what this looks like. But in 75 and older, it's less so. These are people who were not vaccinated when we were in 1A. And so looking at how this is breaking down, again, we go back to Monterey County residents. This time, it's not all residents. These are just Monterey County residents who are 75 and older. About 61% are white, non-Hispanic, and they make up about 66% of 75 plus that have been vaccinated thus far. So we also look at the next largest group, which would be Hispanic, but which make up 24% of 75-year-olds here in Monterey County. And they account for about 15.5% of the vaccines that have been given out to individuals 75 and older. So slightly over, white non-Hispanic population slightly overrepresented in the vaccine distribution, and Latinos underrepresented. And if this were more equal, we would expect to have about 24% of Latinos 75 and older vaccinated, and about 61% of white vaccinated as well. So these are, again, things that we look at in trying to determine how to incorporate equity in our strategies, or working towards equity in our strategies. We also know one more thing is that the state is has a blueprint metric that looks at positivity rates countywide, and also positivity rates specifically in what they call the state calls the Healthy Places Index, fourth quartile. So these are the what the county, what the state has looked at the Healthy Places Index. That looks at all of the zip codes, well, specifically census tracts, but zip codes that are and looks at a variety of social determinants of health, and has identified statewide and also in each county the 25% of zip codes that have the I'd say the worst index, meaning people who live there have historically had the poorest health and social outcomes. And so for Monterey County, for the state has identified these zip codes. And so if we can continue to try to work towards improving access to testing and access to vaccine, and promote measures to reduce the spread of COVID-19 in these zip codes, the positivity rate should decline, which would be good for us in Monterey County as we look at the blueprint metrics and trying to get positivity rate in this group, in these areas down, so that hopefully we can get closer to entering into a less restrictive situation, which would be the red zone in the state's blueprint. So yesterday I announced at the board meeting that we've looked at these factors, these considerations, and proposed a way that would address the county residents most likely to die of COVID-19 and begin to protect additional essential workers in phase 1B, which we've been hearing a lot of people really wanting to get that additional essential workers vaccinated, but also takes into account the equity issues that the state have prioritized and that are important for us as a county to work towards a situation where we have less transmission and we can move into a less restrictive tier in the blueprint. So beginning February 17th, anyone 75 and older will continue to be eligible for COVID-19 vaccination. Individuals that are 65 to 74 and at risk for exposure while they're working in food and ag, childcare, education, and emergency services will be eligible. And people who are 65 to 74 and living in the lowest quartile Healthy Places Index zip codes, which I shared previously, would also be eligible. So, of course, people will also want to know, when can we move to others who are 65 and older? When can we move to other people that are in these sectors who don't meet these criteria? And that's something that we'll continue to look at, meaning we'll continue to look at the data that I shared with you, look at how vaccination efforts are going, looking at how effective we are at getting the target population vaccinated, and looking at what are the most effective ways to vaccinate this group, and working with our providers on that to make sure that we're working together, working with 201, for example, to assist people with getting there and keeping their appointments and scheduling their second appointment. So these are all things we'll continue to look at before making a decision on how we're going to move on to the rest of 1B. We'll also want to see how the state plans to move into beyond 1B. So there may be a need to strategize a way that we can as smoothly as possible transition from this phase that we're currently working on into whatever next step the state has. So I think we'll probably have questions for this, but I'm going to move on to talk about vaccination planning and distribution. We continue to work with our other partnering agencies to identify about how many doses can be administered a week. So we're still looking at about 17,000, although we could increase that by increasing the use of volunteers should more vaccine be made available to us. And this is something that has been shared with the state. So the state knows that Monterey County, if given more vaccine, could administer more vaccinations. Our health department these are some of the strategies that are currently underway in Monterey County. We, as a health department, are conducting our small, medium, and large vaccine points of distribution. Right now, we can vaccinate up to 800 individuals but our staff who've been working there have also been looking at what the maximum capacity might be at some of these larger locations, and we could probably vaccinate up to 3,000 people per day if we had the vaccine. This is an aerial view of one site out at CSUMB, and this is looking south on lot 59 at CSUMB. And I can take you through the process here. So this arrow here is the entrance, and individuals drive up, and the first person they meet a person right here, and that person does a symptom screen to make sure they don't have symptoms of COVID disease. If they're clear, they can move on to the first tent where they can confirm their appointment and verify that they're eligible to receive the vaccine in Monterey County. There is a group, and then the cars, individuals are asked to go to one of 5 lanes through the parking lot. And you can see here, and I have another slide to show us, but you see the line of cars. And this was early in the morning, people arrived early. So we had quite a few cars here, but everyone has an appointment. So we did not have extensively long lines or extensive wait times. And so in the second tents, there's another set of tents here. They're blue tents, and I'll show you in a minute. But that's where our staff go over with the person to make sure they don't have any medical contraindications to getting the vaccine, re-verify that they are who they say they are, so we're giving a vaccine to the right person, and we can provide vaccine education and answer any last-minute questions that someone might have. You can see here those the blue tents here is where we have finally the vaccine is being administered. So the people drive through, and we drop the vaccine into syringes and then hand it over to a nurse, and the nurse goes ahead and vaccinates the individual. And then we have a medical monitoring area, which is this row of cars here. These are individuals who just received their vaccine, and they're parked for a minimum of 15 minutes, and a nurse will check in on them. And after 15 minutes, if the nurse clears them, they can leave the vaccine clinic. This is also, here's the row of cars here. And we're also scheduling second appointments for each of these individuals. As Katie mentioned, we are currently using a state system prep mod, but Monterey County will be switching over to My Turn, which is still a state system. And individuals, when they go on the My Turn, they can actually schedule their second appointment when they're scheduling their first appointment. So that's one advantage of the new system that the state is rolling out. And so we had last 2 recent clinics. We immunized about 1,500 residents 75 years and older. So we have been very successful in getting people through this process pretty smoothly, and I'm very appreciative of all the people who have provided our nurses compliments when they get their vaccine. As a reminder, there are hospital clinics that are scheduling appointments for their patients now. CHOMP and SVMH both have on their website the portals to schedule appointments. NMC and me are still using the state system, and we have that link on our website. And our primary care providers, some of them who are vaccine providers, are also compiling lists that they create on their electronic health records and identifying those that meet eligibility and have been calling and scheduling appointments. Most recently, they've been scheduling appointments for their patients who are 75 and older, and they'll be able to expand that list to identify other people that can be vaccinated. So if individuals think that they're eligible for vaccine, they can call their healthcare provider if the healthcare provider is one of these on the group. Otherwise, they'll probably should receive a phone call from their healthcare provider offering a vaccine when vaccine is available. Safeway stores have started vaccinating individuals here in Monterey County at their 2 locations on Main Street and Constitution Boulevard in Salinas. And there are additional strategies underway. Visiting Nurses Association has been working with CHISPA and now is working with other organizations to bring COVID-19 vaccine to individuals who are 75 and older that live in senior housing. And also most recently, the Veterans Administration has will be receiving vaccine from the VA Palo Alto healthcare system, making that that federal source of vaccine available to qualifying veterans living here in Monterey County. As far as additional strategies and development, CVS pharmacy will be receiving vaccine here in Monterey County. Also, we are Clinic of the Salute is working with ag companies to dedicate vaccine opportunities for farm workers, and our large sites, our current vaccine pods can be expanded to 2,000 to 3,000 people per day when vaccine is available. Excuse me. This is our posted on the website. We update it once a week. This shows how much vaccine we have in Monterey in public health. So we have about 15,000 that have been ordered and received, and we've moved about 1,800 doses to other providers to assist them in their vaccine efforts. We have about 4,000 reserved for our large vaccine pods. Several hundreds of people a day being vaccinated, so this is dedicated to that. The state says that we've vaccinated or administered 5,300 doses of vaccine, but our records show that we have administered almost 6,600 doses of vaccine. So from the 1,500, if we subtract all these doses of vaccine, we have about 2,500, which is about 70% of what we've been allocated and received from public health. That's available to either move to other clinics or to schedule first clinics at our PODs or pods. And this is the best information that we have on the status of vaccine that's gone to other clinics. And I won't go through all of them, but just as an example, Clinic of the Salute has 1,100 that they've received. We've given them approximately 132 doses. The care system is showing 303 doses. However, they tell us that they've given more than 303, but we don't have any numbers yet, so we'll continue to use 303. But we do reach out to all these providers on Thursdays and Fridays of each week, and asking them to give us a verbal report as to how much they actually have administered. So some of them have responded, some of them don't respond, but we do take to estimate how much has been administered in Monterey County, we take the greater of the two. So doctors on duties, the system says that they've administered 394, but they let us know that they have administered 1,084. So we use that as our estimate. And going to the next page, we add those up, and it's about 34,000 doses administered in to Monterey County residents. Overall, the county has received 4,300 doses. Those have been delivered. And so an estimate is that about 78% of the vaccine that's been actually received here in Monterey County has been administered. And that's a rough estimate, knowing that some of our vaccine has gone to vaccinate people who don't live here. And some people who don't live here have gone to other counties to get vaccinated. So this is a rough estimate. And there's also, that's not accounting for people who are getting vaccinated with a federal supply of vaccine, the CVS and Walgreens partnership for skilled nursing facilities, and state corrections who get vaccine directly from the state and not through our allocation. So we have these additional few thousand people who've been vaccinated in Monterey County as well. And we'll continue to update this, hopefully get this vaccine updated at the beginning of every week. So I'll end there and see if there's any questions, Mia.
Oh, and there are. And thank you so much for this really thorough presentation. Let's go ahead and start with the questions that we have in chat. Our first question is, Monterey County working with the state to try to get an Optimserv vaccination site?
So thanks, man. So we have, excuse me, we do have an Optimserv. We have 4 Optimserv vaccination sites We have 4 Optimserv vaccination sites currently, with Soledad being the drive-through, which can, testing sites. We have looked at whether or not we wanted to, so these are the testing sites that we currently have. We have looked at expanding, and we will have an Optimserv traveling testing team beginning to test in Monterey County. This one is intended, if it's approved, intended to go to 2 locations within Salinas City School District and 1 location at the Gonzales Unified School District, with the possibility of expanding to Monterey County Unified School District. And we have looked at whether or not we would want to convert one of these, the traveling team or an Optum site, either walk-up or drive-through, as a vaccination site. And the state has offered to convert, and they have converted some testing sites to vaccination sites in other counties. Those initial rollouts or conversions created some significant challenges for the local health jurisdictions, in that there were unfortunately vaccine appointments that were made that there was no vaccine to give to people, and so people had to be called and cancel their appointments. So we decided to hold off and let the state know that thank you for making it available to us. We'll hold off for now because we have adequate number of organizations and vaccinators here in Monterey County to get the vaccine out, and we have additional capacity. So as Optimserv and the state work out and improve the logistics and operations of converting Optum sites from testing to vaccine, hopefully they'll get to a place where it's running smoothly, and then as more vaccine comes in or an opportunity arises, we could contact the state and ask to convert one of our sites to a vaccine site.
Thank you, Dr. Moreno. The next question is for Kelsey, and I'm not sure she is on the call still. Kelsey, are you on the call? Are you on the call? Nope, she's not on the call, but I will forward the question to her. This is regarding concerns about upcoming rainfall and debris, and I'll get back to everyone with that answer. So Dr. Moreno, the next question is for you. Do you really think it will take 62 weeks to get through phase 1B vaccinations? When do you think vaccine supply will increase nationwide?
All right, thanks, Matt. So the 62 weeks, or the estimates for how long it would take to get through 1B, is an estimate that we use for planning purposes. So we know it's not going to take exactly 62 weeks, and we know as vaccine supply increases that will decrease. But for the time being, we have to use what we've got. That will change. It's already changed. I just updated it just this last week. As far as when vaccine will, and I'm sorry, so what I did simply is, with our epidemiologist, looked at how much vaccine was coming in every week and how many doses would be required to vaccinate the estimated number of individuals in 1B, and did a calculation as to how many weeks it would take at that weekly allocation of vaccine to get through everyone. As for when I think more vaccine will be available, what we want is a larger allocation coming to Monterey County as a whole. It would require that the current manufacturers that are approved to, that's Moderna and Pfizer, that they increase production, or that the FDA provides an authorization to another manufacturer for a third vaccine in order for the amount of vaccine coming into Monterey County to increase. So that's really, we can advocate for more vaccine, we can ask for more vaccine, but most of this is out of our hands. It's at the federal level and the FDA specifically, and the manufacturers who are submitting these requests for authorizations and manufacturing the vaccine.
Thank you, Dr. Moreno. The next question came in for Katie and 211, and I'm going to go ahead and read the question for those of us for the folks who are watching who are not able to see the chat. And then Katie, if you could go ahead and answer that. For 211, how many bilingual staff will be on hand to help with vaccine appointment scheduling? We have fielded complaints previously that there weren't enough or any Spanish-speaking individuals to help out.
Okay, thank you. So our standard staffing capability in Spanish is we expect that about half of the call center specialists, at least half, are bilingual Spanish speaking. For the vaccine registration project, we've hired and are in the process of training 10 new call specialists who will be dedicated to that activity. And I actually don't know, I don't have the profiles of those individuals, but my expectation is that they are at least half bilingual Spanish speaking. And then of course we continue to have teleinterpretation available for other languages, over 150 other languages. And I can certainly come back in the future with more specifics on that breakdown. But last year we served over 40% of our 211 callers in Spanish. So I know we have a pretty strong capability, and apologize when people aren't able to find that Spanish-speaking call specialist.
Thank you very much, Katie, for that answer. Back to Dr. Moreno with a question. Are you getting any pushback on the decision to target subgroups of those over 65 for vaccinations? You're on mute, like me.
I think I think the underlying issue here really is the amount of vaccine that we're getting. And so we have a lot of people in Monterey County who want to get the vaccine, but we don't have enough to go around. And so, so we are following the state's plan, and currently what was previously called 1B is where we're moving through. And with limited vaccine, we do have to make some decisions on who we give vaccine to when it's limited to have the greatest impact on public health. And so when we're not making vaccine available to everyone who feels that they should receive the vaccine, regardless of which step we take, there'll be people who are not happy with the next step, and there'll be other people who'll be delighted to know that they can get a vaccine. So we know that's the case, and regardless of the step we take, that will still be the case. I continue to meet with other health officers from other counties, Bay Area, Central Coast counties with a large proportion of industry that falls into ag, and we're all dealing with a very similar situation in which there's not enough vaccine, and we got to make the best with what we have to have the biggest impact on public health. So we will continue to look at the data, try to be as much evidence-based as possible, and following state guidance and aligning with the priorities of the state to try to roll this out in a way that works for Monterey County with limited vaccine and still follows the state guidance, because we don't want to fall out of line with the state, because that could jeopardize the amount of vaccine that they give to us.
Thank you, Dr. Moreno. And our next question is about registering to get the vaccine. And I think you had a slide that showed the websites where people can go to do that registration. I thought I'd give you a second if you wanted to pull that up, because this question is, how can residents register to get the vaccine? And it is online.
This might be the site you're looking for.
Yes.
The slide, excuse me, the slide. Yeah, so this is a link that can get people to our county website. And at this location, when a clinic is available, you can register to make an appointment if you're eligible. It'll basically put you a person through the state system, and it's only it will only provide access to appointments at providers, or given by providers who are using the state system to make appointments. So right now that's still our public health department, Natividad Medical Center, and also Me Memorial. However, other organizations have their own portals that are being used. So I believe Trump is using their own portal to make appointments, and SVMH, I believe, is also using their own portal. So it'll be important for people to understand that there are different systems that are being used, and the state is making, as Katie mentioned, is making My Turn available to all counties. Will be Monterey County will be able to use My Turn very soon, and they will be requiring. What we're told is the state will require all vaccine providers to schedule appointments through My Turn, with a few exceptions, and we don't know what those exceptions are. The state hasn't made that available to us.
Thanks very much, and thanks for bringing up that slide one more time. And another question for you, Dr. Moreno, just to confirm information from one of your slides earlier, Monterey County has the ability to scale up to 17,000 vaccinations a week, but the current supply is between 2,000 and 4,000 doses per week.
That's correct. That's correct. On average, it's about 3,200, which is slightly improved, but it is going up just a bit. So that's correct.
All right. Thank you. And our next question is in regards to the registration webpage as well. We were just speaking about, would it be possible for the county vaccination registration webpage to include the links to all possible vaccination appointment locations? Right now, there are only 2 listed, when last week there were about 8. One central location for this information would be helpful for people, although I know that when clinics are available, there certainly are more listings. So it could be a combination of things.
Yeah, I wish I was a little more aware of the postings on the website. I'm not. We do have staff that are updating the website as you're right, Maya, as clinics are available. So yeah, so the information, including the number of pods or vaccine clinics that are available, will change from week to week. And having a central place, we continue to explore simplifying it and having one central location. However, the challenge we have is that that the clinics there's more than one portal that is being used here in Monterey County to schedule clinics, and it depends really on the provider that's administering the vaccine clinics.
Thank you. And I'm going to jump slightly out of order to pick up, we're getting close to the end. I'm going to jump slightly out of order to pick up a question from someone who hasn't had one answered yet. Dr. Moreno, did CDPH have to sign off on the county's plan to vaccinate 65 and older in the specific zip codes?
No, there isn't a requirement that the state approve the steps or strategies that a county takes to move through 1B. They just require that we vaccinate only those individuals that are in 1B, which are the sectors I mentioned, and 65 and older, and that we also prioritize 65 and older, and that we do our best to vaccinate as many people as possible in those sectors as long as we have vaccine. So no approval is required. However, we do, as I mentioned earlier, we do everything we can to align ourselves with the priorities of the state, so that the state has confidence that if they give us vaccine, that we'll administer it in the manner in which the state has planned.
Thank you. And then another question for you. Do you have any concerns about people not being able to get their second doses in time?
Here in Monterey County, let me back up. There was a point several weeks ago where the state of California, California Department of Public Health encouraged local health jurisdictions to take their second doses and administer them as first doses. The idea was that this federal government, the federal administration had said that there was a stockpile of vaccine that they were getting ready to release. And so California wanted to essentially give as many doses as they could in a short amount of time so that we could demonstrate the greatest need for additional vaccine out of the stockpile. So some counties went ahead and took second doses, and rather than giving them as second doses to someone who's already received a first dose, they gave it to people who hadn't been vaccinated yet. So as we know, as it turns out, there was no stockpile vaccine. And so those counties, some counties are struggling right now to get second doses into to people who, because it's time to get a second dose. So what those counties are doing is they are not scheduling first dose clinics, and they're using whatever vaccine they get from the state to get those second doses administered. And they're also utilizing a CDC guidance that says that in certain circumstances, the second doses can be administered up to 42 days after the first dose. And so that's something that those counties are using to justify giving second doses a little late. Here in Monterey County, we did not take second doses and administer them as first doses. So we continue at this time. It appears that we still have enough second doses to administer when they are due. So the main challenge would be an individual making sure that the individuals schedule their second dose appointment, and they know when that appointment is due, and they bring information with them to the second dose appointment to make sure that they're getting the right dose in either 3 weeks or 4 weeks after the first dose, and if necessary, getting assistance from 211, getting assistance from family members who might understand how this procedure works, and getting back for seconds. That's probably one of the bigger challenges that we have.
Thank you very much. Another question for you. We saw the letter from the Monterey County supervisors about being at a possible vaccine disadvantage compared to other counties with a lack of MCEs and incoming ag workers. Do you believe this is the case as well?
Excuse me, ma'am. Yeah, so I think that what we're seeing might show that we are getting less vaccines. So we have asked the state to provide more detail on how they're allocating vaccine to the locals. So we do know that there's a federal allocation that the state never sees. That goes to federal agencies here in California. And then the rest of the vaccine, California knows what they're getting, but they have to give some of that vaccine to state agencies. And then what's left over, and some to the MCEs, and then what's left over gets divided primarily to local health jurisdictions. And so they did verify that the MCEs they get their doses taken off the total amount before they allocate to locals. But they haven't provided any more detail as to how that formula, what formula they're using. So at this point, it does appear, based on what we're seeing, that counties that have an MCE or multi-county entity provider in their counties those counties overall are probably getting a greater proportion of vaccine than counties that don't have an MCE. So, for example, Santa Cruz County has, I think, Dignity Health, and I think they have another organization there, and they have the MCE allocation coming in, and then the local health jurisdiction allocation coming in. And so the consequence there is that those counties, or the residents in those counties, have a greater opportunity to get vaccine, because the counties, the MCE or the local health jurisdiction, or both, can move more quickly through 1B because they have more vaccine. So it looks like that's the case. We are still just waiting. We'd like to hear from the state for an explanation on how those allocations have been made and how those allocations are going to be made moving forward. We also know that I think in about a week, the state will release information or release the contract that they're negotiating with Kaiser and Blue Shield to be the third-party administrator. And so the current allocation methodologies, along with a lot of other things associated with vaccine rollout, may change under the third-party administrator.
Thank you. And then I'm going to try to squeeze in one last question before our hour is up. Is there a worry with lower testing numbers we could get to a point where it impacts our ability to leave the purple tier?
Thanks, that's a good question. So why don't if I can show another slide?
Yes, please.
Okay, let me get there first. All right, hopefully you're seeing a graph.
Yes, it's there.
All right. Okay, here we go. Okay, so this is the positivity, oh, excuse me, wrong one. Excuse me. Here we go. This is the case rate here in Monterey County, for Monterey County. This is the case rate that the state calculates. And the case rate is an adjusted case rate. And so for Monterey County as of January 30th, the period of January 30th, case rate is 38.9. That's adjusted. It's still greater than 7, but we would have to get 4 to 7 in this range to move into the orange tier, or red tier, excuse me. And we can see that for the last 4 weeks, the case rate has dropped significantly. But again, this is the 38.9 is the adjusted case rate, Maya. The actual case rate is 37.2. And so the state, in making the adjustment, the state looks at whether a county's testing rate is higher or lower than the state average. So for the last few weeks, our testing rate has been higher than the state average. And so even though our actual case rate was 89 here in January, it got adjusted down to 84. And even though our actual case rate was 98, because we're testing so many people, we're going to find more cases. They adjusted down to 80.3. And that's an attempt to make things a little more comparable across the state. However, we have noticed that in the last 3 weeks, the testing rate has dropped, and it's dropped to about the average across California. And because we're right about consistent with the average testing rate in California, there's very little adjustment in the last 3 weeks. So our actual case rate was 70. It got adjusted down a little bit to 66. And then actual was 52. And it basically, there was no adjustment. And then this week, our actual is 37 and actually got adjusted up to 38.9 because our testing rate has declined. So yes, the answer to the question would be yes. And that's why it's still very important, unless the state makes an adjustment to a change to this metric. It will be very important for people to continue to get tested. So as we are focusing a lot on vaccine, we still need to continue to remind people that if they are symptomatic or have been exposed to COVID-19, they should still consider getting tested to know whether or not they have COVID-19 and take appropriate action. So testing is still going to be important for us in Monterey County.
Thank you very much, Dr. Moreno, for going back over that chart. And that wraps up our media briefing for today. Thanks for everyone who joined us today. Our next briefing is next Wednesday, and we'll see you then.
Bye.
Bye-bye.